You say sit and nothing happens. You call their name from across the yard and they just stand there. Your dog used to be sharp, reliable, and tuned in to every word you said. And now it feels like they have stopped caring. But before you assume your senior dog is being stubborn or has just given up on listening, I need you to consider something. What if the problem is not that your dog will not respond? What if the problem is that your dog cannot? A study published in Today's Veterinary Practice estimated that about 28% of dogs between 11 and 12 years old show at least one sign of cognitive change, and that number climbs to roughly 68% in dogs between 15 and 16 years old. Those are high numbers, and most of those dogs were never formally diagnosed because the owners assumed the changes were just normal aging. On top of that, the 2023 AAHA Senior Care Guidelines recommend that veterinarians screen for behavior changes using a tool called the DISH-AA checklist, which looks at disorientation, changes in social interactions, sleep-wake cycle disruptions, loss of house training, altered activity levels, and increased anxiety. Many of those signs overlap with what owners describe as "my dog just stopped listening." I am going to walk you through 5 things that can cause a senior dog to stop responding to cues, how to tell whether you are looking at a training issue or a medical one, the specific adjustments that make training work again for an older dog, and the signs that tell you it is time to call the vet before you change anything else. Here are the 5 most common reasons a senior dog stops responding, and I have ordered them by how often I see owners miss them. Number 1 is hearing loss. This is the one that hides in plain sight. Hearing loss in dogs tends to happen gradually, and because your dog still responds to some things, you might not realize how much they have lost. They still come when the treat bag crinkles because they feel the vibration. They still react when you walk into the room because they see you or smell you. But when you call their name from another room or give a verbal cue while you are behind them, nothing. It is not stubbornness. They literally did not hear you. The home test for hearing loss is simple. Wait until your dog is awake but facing away from you. Then make a sudden sound behind them. Clap your hands, drop your keys, or call their name at a normal volume. If they do not react, try it louder. If there is still no response, you are likely looking at significant hearing loss, and your vet should do a proper evaluation to confirm. The training adjustment for hearing loss is straightforward and honestly kind of exciting. Switch to visual and tactile cues. A hand signal for sit, a thumbs up for a recall, a gentle tap on the shoulder to get their attention before you give any cue at all. Most dogs learn hand signals quickly, and many trainers, myself included, recommend teaching hand signals alongside verbal cues from the very beginning of a dog's life, specifically because this day will come for most dogs who live long enough. Number 2 is pain. This is the one that breaks my heart, because a dog in pain looks like a dog who does not want to cooperate. You ask for a sit and they just stand there. But sitting hurts. You ask for a down and they refuse. But getting down and getting back up puts pressure on arthritic joints. You call them and they come slowly or not at all, because walking at speed is painful. Dogs are remarkably good at hiding discomfort, and by the time the behavior changes are obvious, the pain has usually been building for a while. Watch for these signs: reluctance to climb stairs or jump onto furniture they used to access easily. Stiffness after naps or resting, especially when they first stand up. Shifting weight off one leg. Panting when they are not hot and have not exercised. Licking or chewing at a specific joint. A sudden dislike of being touched in a particular area. Any of those alongside a decline in cue responsiveness is worth a vet visit to check for pain, arthritis, or another orthopedic or neurological issue. Once the pain is managed, and your vet has a lot of options for pain management in senior dogs, you can adapt the cues themselves. If sitting is uncomfortable, teach a stand-stay instead. If lying down is hard, use an elevated bed that is easier to get on and off of. The cue does not matter as much as the communication. Find the positions your dog can offer without discomfort and build your training around those. If you are finding this helpful, subscribe. I cover training at every life stage, and your senior dog deserves the same thoughtful approach you gave them as a puppy. Number 3 is vision changes. Senior dogs can develop cataracts, glaucoma, progressive retinal atrophy, and other conditions that reduce their vision gradually or suddenly. Like hearing loss, vision changes can creep in slowly enough that you do not notice until the gap between what you are asking and what your dog can see becomes obvious. A dog with declining vision may not see your hand signal from across the room. They may startle when you approach from a blind spot. They may bump into furniture that was recently moved or hesitate at doorways they used to walk through without a second thought. And they may appear to ignore you simply because they did not see you asking for something. The training adjustment for vision loss is to work closer, use bigger and slower hand movements, and add a verbal marker like a clicker sound or a consistent word so your dog knows exactly when they have done the right thing, even if they cannot see your face clearly. Keep the environment consistent. Rearranging furniture can be genuinely disorienting for a dog who is navigating partly by memory. Use textured mats or rugs at key transition points like doorways and the top of stairs so your dog has tactile landmarks to orient by. And keep training sessions in well-lit areas where your dog's remaining vision works best. Some dogs with early cataracts see better in bright environments, while others are more comfortable in softer light. Pay attention to when your dog seems to track your movements most easily and use those conditions for training. Number 4 is cognitive dysfunction. This is the one people know the least about, and it is more common than most owners realize. Canine cognitive dysfunction syndrome is similar in many ways to dementia in humans. The DISH-A categories I mentioned earlier cover the main signs. Disorientation, where your dog gets stuck in corners, stares at walls, or seems confused in familiar places. Changes in social interactions, where they become clingy or withdrawn. Sleep-wake cycle disruption, where they pace at night and sleep more during the day. Loss of house training, reduced activity or restless, repetitive activity, and increased anxiety, especially around routines that used to be predictable. A dog with cognitive dysfunction may hear you say sit, may physically be able to sit, and still not connect the word to the action. The processing pathway between the cue and the response has become unreliable, not because the dog is choosing to ignore you, but because the brain is no longer routing the information the way it used to. If you suspect cognitive dysfunction, please talk to your vet. This is not something you should try to train through on your own, and it is not something that just gets better with patience. There are medications, dietary changes, and environmental enrichment strategies that can slow the progression and improve your dog's quality of life. Selagiline is one medication that is used specifically for canine cognitive dysfunction, and your vet can discuss whether it is appropriate for your dog's situation. Diets rich in antioxidants and medium-chain triglycerides have also shown benefit in veterinary studies. And mental enrichment, puzzle feeders, scent work, short, gentle training sessions focused on simple wins helps keep the brain active and engaged. The enrichment does not have to be complicated. Scatter a handful of kibble in the grass and let your dog use their nose. Hide a treat under a cup and let them figure it out. Those small moments of problem solving matter more than you might think. Early intervention gives you and your dog more good time together, and the gap between early and late treatment can be significant. Number 5 is general fatigue and recovery. An older dog's body simply does not bounce back the way it used to. They tire faster, they need more rest between activities, and they may only have a few minutes of focused attention in any given session compared to the 20 or 30 minutes they could handle as a younger adult. If you are asking for a long training session and your dog checks out after 5 minutes, that is not disobedience. That is an energy budget that has shrunk, and your training schedule needs to shrink with it. Watch for the signs that your dog is done. Slow responses, turning away from the food, lying down mid-session, yawning. These are not refusals. They are your dog telling you the tank is empty. When you see them, end the session on whatever the last successful moment was and let your dog rest. A tired senior dog who gets pushed past their limit does not learn anything. They just practice failing, and that is not fair to either of you. Shorter sessions, more frequent breaks, and lower expectations for sustained duration work. 2 or 3 sessions of 3 minutes each across the day will do more for your dog than one long block. That is what training looks like for a senior dog, and it is not a downgrade. It is respect for where your dog is in their life and what their body and brain can realistically give you on any given day. Now let me talk about the training adjustments that work across all 5 of these causes, because regardless of which one is driving the change, these principles apply. First, get closer before you give a cue. Do not call from the other room and wonder why nothing happens. Walk over, get your dog's attention visually or with a gentle touch on the shoulder or chest, and then give the cue from a close, clear position. This single adjustment accounts for hearing loss, vision changes, and slower cognitive processing all at once. It costs you 5 extra seconds and it changes the success rate dramatically. Second, simplify your cues. If your dog knew 12 different commands at age 3, do not expect them to maintain all 12 at age 12. Focus on the cues that matter most for safety and daily life. Come, sit or stand, wait, and leave it. Let the rest go gracefully. Third, increase the value and frequency of your rewards. A senior dog who gets a tiny piece of kibble for sitting is not going to be motivated the way they were at 2 years old. Use something your dog genuinely loves and deliver it every time they respond correctly. This is not the stage of their life where you fade the rewards to see if the behavior holds on its own. Reinforce generously. They have earned it. Fourth, adjust the physical expectations. Everything I said about pain applies here broadly. If a cue requires a posture or movement that your dog finds difficult, change the cue. Train around the limitation instead of through it. And fifth, check in with your vet at least twice a year. The 2023 AAHA guidelines recommend that senior dogs get wellness exams every 6 months instead of once a year, because things change faster at this stage. A behavior change that looks like training regression might be the first visible sign of a medical condition that is much easier to manage when caught early. Before I let you go, here are the signs that should send you to the vet before you change anything in your training. If your dog suddenly stops responding to everything, not gradually but abruptly, that could signal a stroke, a neurological event, sudden hearing loss from an infection, or an acute pain episode. Sudden changes are not training problems. They are emergencies or near emergencies, and they need professional evaluation right away. If your dog becomes aggressive when you ask for a cue they used to perform willingly, especially a cue that involves a body movement like sit or down, pain is the most likely explanation. Do not push through it. Do not correct it. Get to the vet. If your dog is pacing at night, getting lost in the house, having frequent accidents after years of reliability, and showing confusion during routine activities, that pattern points toward cognitive dysfunction. The earlier your vet evaluates it, the more options you have. Your senior dog gave you their best years. They learned your cues, lived in your world, and adjusted to your routine for a decade or more. They figured out your schedule, your moods, and the sound of your car in the driveway. Now it is your turn to figure out what they need. Read the signals, adapt the training, protect their dignity, and meet them exactly where they are today. Not where they were last year, and not where you wish they still were. Right where they are. That is what good handling looks like at every age, and your dog will show you they still have plenty to give when you stop asking for the things they can no longer do.